I received a message from one of my followers requesting to know if a man can ejaculate without sperms. Good day everyone, my name is Gwendolyn Hale. I'm a medical microbiologist and popularly known as the medical professional with the difference, because I bring you knowledge on health, medicals, hygiene, business and a bit of farming. To all my returning subscribers, I want to say thank you. I love you. And if you just stumbled on this video, stumbled on my channel, join the family. Your health is wealth. Remember, we are looking at the question that a follower asked. Can a man ejaculate without sperms? And the answer is yes. The medical term for that is azoospermia. So what happens during azoospermia? A man would ejaculate, but no sperm will be in the semen. So what you see when a man ejaculates is semen or seminal fluid, but it doesn't contain any sperm. Now, azoospermia leads to infertility. There are two types of azoospermia: obstructive azoospermia and non-obstructive azoospermia. Now, let me break it down to you in detail. Obstructive azoospermia is when a man's testicles is capable of producing sperms or produces sperms, but the sperms cannot be ejaculated, or that the man's body cannot ejaculate the sperms. In other words, that means that there's something preventing, or things preventing, a man from ejaculating sperms, although he produces sperms. Now, on the other hand, when it comes to non-obstructive azoospermia, that is, nothing is obstructing the man from ejaculating sperms, but his body does not produce sperms. That means that his testicles do not produce sperms, although nothing is obstructing him from ejaculating the sperms. So in both cases, in a nutshell, what you see as an ejaculation from a man who has azoospermia doesn't contain any sperm, but it contains semen. The sperm is responsible for fertilizing the eggs. Some causes of obstructive azoospermia are, point number one, injury. If a man has got an injury on his testicles, that will prevent him from ejaculating sperms. Sexually transmitted disease, especially chlamydia and gonorrhea, that cause inflammation, can prevent a man from ejaculating sperms that have been produced in the testicles. The next point is previous surgery. Another point which is very important is vasectomy. Vasectomy is when the tubes of a man are being tied. So when the sperms are produced in the testes, it cannot be ejaculated out. So those are some reasons, common reasons of obstructive azoospermia. Now we're looking at non-obstructive azoospermia. And the point number one is when the testicles of a male have not descended out of his body, have not dropped out of his body. This is a problem. This is a serious issue. Just know that it will be difficult for a man to even produce sperms, because the body temperature, the normal body temperature, that is 36.5 degrees to 37.5 centigrade, is very high for a male to produce sperms, for the testicles to produce sperms. Now the next point is, if a man has small testicles, that means a grown-up man has got the size of testicles of a little boy. That means his testicles have not matured. That's going to be a serious issue. He will not be able to produce sperms. Or that means his testicles haven't gone through puberty. The next point is, if the man has got ejaculation problems or erection problems. That's a big issue. Another point is hormonal imbalance, particularly in the case where a man starts noticing that his body hairs or his facial hairs begin to reduce. That indicates that the testosterone in his body is dropping. So there's no way he's going to be able to produce sperms, because testosterone is responsible for the production of, is a hormone responsible for the production of sperms in the man's body. And also, and the last point is genetics. Genetics. So how can we treat this azoospermia? Now the treatment would depend on the cause. If it's an obstruction, then your doctor will be able to take away the obstruction so you can ejaculate properly. If it's a hormonal problem, you will be given hormonal pills to balance that out. Hormonal pills that will contain testosterone. Or if a man is having high prolactin levels, hormonal injections or pills will be given to the man to reduce the level of prolactin, so he'll be able to produce sperms. Now, if it's a case where he's had a vasectomy and all that, his tubes will need to be rejoined, joined back again. If it's a problem of that his testicles have not jumped out of his body, surgery will have to be done to bring out the testicles out of his body. You know, so there are a lot of things. So all of this would depend. All of this would depend on the cause of the problem. So there is no particular treatment for all the causes that I have mentioned. So how can we prevent azoospermia? Point number one, avoid steroids and exposure to heavy metals and pesticides. These can directly affect your fertility. That can actually cause you not to produce sperms. This can actually make your body not to produce sperms. This is very important, especially steroids. And sometimes you may not be directly exposed to lead or mercury or sulfur or these pesticides, but you could be in an environment where the water has been contaminated with these metals. So this is very important. Keep that in mind. The next point is protect yourself from sexually transmitted diseases. Sexually transmitted, especially chlamydia and gonorrhea, which will actually cause an inflammation and cause obstructive azoospermia. Now, the first point I gave on the exposure of steroids, pesticides, heavy metals would cause non-obstructive azoospermia. The next point on the list is avoid exercises that affect the male organ. For example, horse riding, biking, any form of sport that will cause direct trauma to your testicles. Because this may cause an inflammation, this may cause injury, and this injury will cause obstructive azoospermia. And next point is avoid radiation, excess radiation, X-rays, magnetic rays, X-rays. If you're a radiologist and you work in a hospital, make sure that once you are turning it on, these radiations are turned on or emitted, or if you are an engineer, once these radiations are exposed, protect yourself. You're always protected. You're always protected. And make sure the room that you are in as a radiologist is actually shielding these rays from getting in contact with you. The next point is excess heat. Avoid excess heat on your testicles. Now I'm talking about using your laptop on your thighs for a long period of hours, entering a sauna, entering a steam room. Make sure everything is regulated when it comes to using a steam room and sauna. 10 minutes in, 10 minutes out, and make sure you cool your body real well. So thank you for joining me in this short class, and I'm very grateful. Till next time, I remain your favorite medical professional, Gwendolyn Halle. Bye-bye.